Jason Krischer. I'm a Facility Care Corporate Account Manager with Ecolab, supporting Hill & Marks in the Northeast U.S. I've been working with Hill & Marks for about the past 12 years, and they are a phenomenal partner with Ecolab and really allow us to go out and help our customers on a daily basis. They had reached out to me concerning the resuming operations for many of you, and some of the things that we need to watch out for in that process to make sure that we're providing a safe, clean, and healthy environment for not only our employees, but also our patrons and the clients that are going to be coming into the facility. So with that, I asked our technical experts from Ecolab Corporate to, if they'd be available to put on a presentation for everybody. That I will pass it over to Ed Snodgrass, who is going to walk us through the presentation today. Thank you.
Great. Thanks, Jason, and thanks, Hill & Marks, for having us here. Really appreciate it. I'm looking forward to bringing you this material. And today I'll be talking about resuming operations, cleaning and disinfection guidance for K-12 schools and higher education to safeguard faculty, staff, and students against COVID-19. And I do want to say before I get into it, all the material that you see here is available electronically. So if you have questions about things that I discussed and you want me to go over it, the material is available and we can provide it to you. So let's get going. So after I go to the next slide here, there we go. So my name is Ed Snodgrass. I'm a program leader at Ecolab. I work in our research development and engineering division, and I lead a team. And my team, we're all technical, and we support our corporate account customers. So some of our larger customers. So my team, we're the technical support. We support the customer. We support the sales team. And recently, we've really become experts in COVID-19, for products and procedures. So, which is why I'm here talking to you about this today. So at the end, I'm more than happy to answer any questions you may have. So my background, bachelor in chemical engineering from University of Wisconsin-Madison. I've got 15 years in the industry, all of them with Ecolab, and research and development. And I'm coming to you from my unfinished basement, which people like to point out. I don't know why, but I am. So sorry, it's not fancier than that. So the agenda today, I'm going to talk to you about preparing for resuming operations, safeguarding your employees, best environmental hygiene practices across your operation, focusing on public spaces, dining areas and kitchens, and reassurance tactics. So let's talk now about preparing to resume operations. So it's important to understand the risk factors associated with this novel coronavirus. So novel coronavirus enters your facility in one way, through infected persons such as faculty, staff, and students. So novel coronavirus is spread mainly through two ways. First, through droplets in the air when someone coughs, sneezes, or talks, and second, through touching contaminated people, objects, or surfaces. It's very important to implement advanced hygiene, and public health recommendations focus on standard infection control practices, training, and compliance. And there's really two ways to do it. The first way is personal hygiene. That includes washing hands frequently with soap and water, or using an alcohol-based hand sanitizer when there's no soap and water available, minimizing close contact with people who have symptoms, ensuring proper use of personal protective equipment when appropriate. And really the second way to do this is through environmental hygiene. So cleaning, disinfecting surfaces and high touch point surfaces. And I'll be talking to you about both of these as we go forward. So, sorry, gotta get control of my slides here. So when you're preparing for resuming operations, consider dedicating a shift to cleaning and disinfection to assure a safe return to faculty, staff, and students. Focus on high touch point surfaces, including but not limited to the ones listed below. Common high touch points include door handles, hand railings, sink faucets, and many others. So like I said, there's a lot listed in this document. And if you want, you can go through it yourself and use this as a guide for high touch point surfaces. So now let's talk about safeguarding faculty and staff. So the best way to do this is really to develop a plan. So some considerations are to educate faculty and staff on the symptoms of COVID-19 and what to do if you're showing symptoms. Reinforce personal hygiene, cough etiquette, and social distancing as recommended by local and federal public health authorities, and provide hygiene materials such as tissues, soap, sanitizer, among the additional considerations listed here. Next, promote infection prevention among faculty and students. There are some simple ways to help reduce the risk of transmission. One of them is washing your hands often and correctly, covering your mouth and nose when coughing or sneezing, avoiding close personal contacts with infected individuals, thoroughly cleaning and disinfecting personal items, staying at home while you're sick, and contacting a doctor immediately in the event of symptoms. So if done properly, hand washing is a great way to prevent the spread of COVID-19. To properly wash your hands, wet your hands with soap and water, lather the backs of hands between fingers and under nails, and scrub for at least 20 seconds. I really think most people tend to skip or cut short. It's very important to do so for that long. Then when you're done, rinse hands under clean running water, and then clean with a clean towel, or dry with a clean towel or an air dryer. If soap and water are not available, you can use an alcohol-based hand sanitizer. You just apply the hand sanitizer to your hands, get them thoroughly wetted, rub them for 30 seconds, and then let them air dry, not rinse. Hand sanitizer, like I said, should only be done when there is no access to soap and water. Proper gloving is also very important. So in order to glove properly, wash your hands first, like we just discussed, and apply the gloves. After the gloves have been used and you're ready to dispose of them, so as not to come into contact with the outside of the glove. So take the one gloved hand and remove the glove from the other hand. And then now take your clean hand and slide it underneath the glove on the remaining hand, and then remove the gloves. And do so without contacting the outside of the gloves. And when you're done, wash your hands. Now let's talk about ensuring environmental hygiene. So it's very important in these times that faculty and staff understand and explicitly follow proper cleaning and disinfection procedures. So there are 5 main factors of cleaning: time, temperature, chemical action, mechanical action, and overall procedures. With a focus on overall procedures, the 4 of the factors can easily be achieved. Consider focusing on the proper solutions and tools for the job, the importance of contact time for disinfection, increased frequency of cleaning and disinfection, and increased awareness of safety considerations. Doing these things will help give faculty, staff, and students peace of mind that you are doing everything you can to keep them safe. And there may be various tools used, to achieve environmental hygiene, and they each have a specific job. So I thought I'd ground us on what those are today. So a cleaner helps remove soil such as food particles, dirt, or other impurities from a surface. A sanitizer reduces, but does not necessarily eliminate, the amount of bacteria on an inanimate surface significantly. And I want to emphasize the word bacteria there. Sanitizers are not used for viruses, which COVID-19 is. And a disinfectant is used on non-living surfaces and objects to destroy or reversibly inactivate infectious bacteria and viruses. So disinfectants will actually kill viruses. So this would be the type of product necessary to address concerns about COVID-19. Both sanitizers and disinfectants are regulated by the US EPA and are used to manage public health risks. The label is the law on these types of products. These products must be used according to the label directions. These products are not for use on or in humans. They should be used exclusively on inanimate objects and surfaces. So follow these steps to properly disinfect a surface. The first thing you want to do is pre-clean the surface. So you can use a cleaning product for this, remove all visible soil. And then second, you want to apply the disinfectant. So use an EPA registered disinfectant approved for use against SARS-CoV-2, which is the same as COVID-19, and refer to the product label directions on how to properly apply it. So typically you'll spray the product on, let it sit on the surface for the appropriate amount of contact time, and this is designated by the product label. Again, very important to follow the product label, and it's very, very important to follow this wait time. As with washing hands, the 20-second piece, like I said, is typically skipped. This is the part that's typically skipped with the disinfectant. Most disinfectants will have, anywhere from a 30-second to a 10-minute dwell time required to get the actual disinfectant required per the product label. So make sure you understand the label. And when you apply the disinfectant, you let it sit and the surface to remain wet for that amount of time. When that time is done, you can either let the surface air dry or you can wipe it with a clean cloth to dry it. For food contact surfaces, which are very different than non-food contact surfaces. So food contact surfaces you'd find in the back of house in a kitchen. You could consider tables in the front of a house where people are sitting, and dining as food contact. So with these surfaces, a typical wash, rinse, and sanitize is appropriate, as the food code states. However, during an outbreak or an active outbreak within the facility, you could add a disinfection step. So what you would do is you'd pre-clean the surface. You would then disinfect and wait for the appropriate amount of time, like we just talked about in the last slide. And then you're going to rinse that with potable water. Following that, you'll sanitize the surface with an appropriate food contact sanitizer. So you should consider and document frequency of cleaning disinfection in your reopening plans. The main environmental variables to consider are infection risk in your surrounding area, anticipated foot traffic on premise, and soil load. As infection risk, foot traffic and soil load increase, so should the frequency of cleaning and disinfection. Areas with higher foot traffic, you want to disinfect more frequently. This requires an evaluation of standard operating procedures pre-COVID to understand if they are appropriate to protect your faculty, staff, and students. Likely, you will want to employ more frequent cleaning and disinfection until the risk of COVID-19 begins to subside. One of the most frequently asked questions in regards to COVID-19 is what to do about soft or porous surfaces such as upholstery or drapes. Typically, disinfectants are not approved for this type of surface. So early research has demonstrated that the virus may only be viable for about 24 hours on the soft surface. And the CDC recommends the following for handling soft surfaces. Either remove visible contamination and clean the surface using soap and water, or with a cleaner appropriate for this type of surface. Or you could launder the item if possible according to the manufacturer's instructions, ensuring the items are dried completely. We will discuss, and as for carpets, floors, and rugs, vacuum as usual. Now let's talk about best practices across your operation. So we'll start with public areas. So disinfection should be most frequent in public areas, especially those with high traffic. Currently, the CDC recommends these areas are disinfected multiple times per day at a minimum. As we discussed, risk is a huge factor in the determination of frequency. Focus on disinfection on high touch point surfaces, hard non-porous surfaces, ensuring treated surfaces remain wet for the proper contact time. Disinfect surfaces after each customer interaction, for example, where people are congregating, and offer hand sanitizer for instances when hand soap and water is not readily available. Consider providing disinfectant and cloths or disinfectant wipes. Best practice related to cleaning may be to provide markings on the floor to encourage social distance for any on-site requirements for PPE, and consider removing non-essential items and rearranging common areas to comply with social distancing. For pools, ensure water chemistry is within normal operating limits and stabilized. Sand filters have been backflushed and circulating water systems are operating. For the CDC, proper operation, maintenance, and disinfection with chlorine or bromine of pools to remove or inactivate the virus that causes COVID-19. There is no evidence that COVID-19 can be spread to humans through the use of pools. For concerns around Legionella, it is best to work with your NALCO representative at each operation will be in a unique position to reopen. So now I'd like to take you through two specific procedures. This one's for classrooms, libraries, and office spaces. So what we recommend is first to pick up debris and remove gum from the floor with a putty knife or blunt edge tool. Empty the trash cans and recycling bins, making sure to securely tie off the full bags for transport. And then we'd recommend disinfecting the outside of those garbage receptacles. Dust filing cabinets and bookshelves as needed, and then clean and dust all hard, non-porous surfaces, focusing on high touch points, and then use a multi-purpose disinfectant to disinfect these surfaces. And then ensure, of course, to remain wet for the amount of contact time as appropriate by the product label. And for electronics, don't spray directly on the surface. Spray the cloth and wipe the surface. Vacuum carpets, rugs, or sweep then mop hard surface floors with floor cleaner as needed. And then inspect for quality. And when you're doing the disinfecting step on high touch point surfaces, focus on things such as doorknobs, push plates, light switches, public phones and computers, desk, tables, and chairs, including armrests, coffee, and beverage stations, etc. So for public areas or places where students may congregate, you have food contact surfaces and you'll have non-food contact surfaces. If there are food contact surfaces, such as countertops where people are preparing food, these would be treated a little bit differently than a standard tabletop or non-food contact surface. So for the food contact surface, we recommend clearing off any debris and then washing, rinsing, and sanitizing that surface with an appropriate EPA sanitizer. If you feel like there's an outbreak in your facility, or you know there's an outbreak in your facility and it's confirmed, or there's a high-risk population, again, you could add in that disinfection step after the clean. You would disinfect, you would rinse with potable water, and then you'd follow up with a food contact sanitizer. For non-food contact surfaces, you'd follow your standard disinfection protocol. So you'd empty your trash cans, recycling bins, you disinfect the outside of those, you pre-clean any visibly soiled areas, disinfect all hard, non-porous surfaces with a multi-purpose disinfectant. Clean glass and windows using the same product if you can, or use it. Yep, go ahead.
I'm listening to a webinar. Could you get a hold of somebody to let me in over a camera so I can get that in good?
Sorry, can we mute the phone? All right. And then follow up with a vacuum the carpet or vacuum sweep the hard floor, and then use a floor cleaner as needed to clean. And then when you're done, inspect for quality. And again, specific touch points, you focus on would be bar tabletops, counters, food and drink prep areas, utensils, dishes, and for non-food contact, doorknobs, cooler handles, light switches, beverage stations, chairs, and those sorts of things. So for restrooms, here are some best practices. Ensure that hand soap is sufficiently stocked and paper towels or hand dryers are available. Frequently disinfect hard non-porous surfaces throughout the day, including high touch point objects like stall doors, locks, and any faucets. Consider posting cleaning schedule in the open for public viewing. This is a great way to reassure your facility, your faculty and staff that the highest level of attention is being paid to heightened sanitation. Employ a bathroom cleaner, disinfectant, approved for use against COVID-19 so that all surfaces within the restroom are being cleaned properly and disinfected. So our best practices for food service in the front of the house include disinfecting high touch point non-food contact surfaces frequently. Train the staff on proper hand hygiene protocols, using personal protective equipment, use in proper cleaning procedures for chemicals. Minimize items offered on tables to disinfect any that may remain between students, faculty, and staff. Encourage social and physical distancing by spreading out tables and encouraging staff to minimize use of high traffic areas. Eliminate any food debris to prevent pest activity. And consider use of prepackaged foods or more grab-and-go type items. For the back of house, there's currently no evidence to support transmission of COVID-19 associated with food or food packaging. For back of house or kitchens, the best practices are quite similar to what they were before. Continue to follow good safety practices for food contact surfaces, possibly wash, rinsing, and sanitizing more frequently, and then practice your standard procedure for washing reusable ware in either the dish machine or the 3-compartment sink. Focus on disinfection on high-touch, non-food contact surfaces, particularly in high-traffic areas. This can include the handles on ovens and things such as that. Ensure that hand washing stations and hand sanitizer are convenient and highly visible. Train staff on proper hand hygiene, use of PPE, and procedures for food contact versus non-food contact surfaces. Ensure physical distancing of employees is standard practice. This includes on the cook line, and thoroughly clean drains and eliminate standing water, food debris, and spilled garbage to prevent pest activity. So for the faculty and staff and break room, increase the frequency of cleaning and disinfecting during high traffic times. So post hand hygiene guidance visibly near hand washing sinks, provide disinfectant and cloths or disinfecting wipes for areas that the faculty is responsible for, self-cleaning, and spread out seating to encourage physical distancing. Stagger shifts and breaks to minimize staff gathering. There are many ways to assure your guests or your faculty and staff and students, as you resume operations. You might prepare a message for your for your faculty and staff, to share with customers upon arrival. You might increase cleaning and disinfection frequency during high traffic periods to increase faculty and student visibility of these tasks. You might add signage or common areas. And finally, giving faculty and students the opportunity to provide feedback on the cleanliness of your operations to reinforce your commitment to their well-being. And finally, Ecolab has many resources to help you through this time, including COVID-19 information, education guidance, procedures as we just discussed, and information for operating under special conditions. And what I just shared with you are the high-level summaries, if you will, of the different procedures that we offer. Within each of the areas that I discussed, we have in-depth, step-by-step procedures. So as you reopen and resume operations, you can safely clean, disinfect, and implement proper employee hygiene to ensure that you're doing everything you can to keep faculty, students, and staff safe in this time of COVID-19. So now I'd like to open it up to questions. So I think if there are any questions, please unmute your microphone and let me know what they are, and I can help answer them for you.
Yep, if you have any questions or want him to follow up on anything that he presented, please reach out in the chat box or unmute yourselves, and Ed would be happy to answer. I do believe we have Helen Marks, VP of Sales, Joe Waite on the call too. If you have any Helen Marks specific questions, just feel free to enter in the chat or unmute yourselves.
Yes, this presentation is available to, I work with staff. I work with the Department of Recreation here in the city of Albany, and into options of having some sort of day camp type situation. Although albeit our facilities still remain closed at this time, so I just wanted to confirm that this might be available to use as a resource with working with frontline staff and operations staff members.
Jason, is that something that you can provide? It is available information. I just want to understand the proper channel to get it to people on this call.
Yes, absolutely. Brian Speck is also on the call today, and he is our Ecolab representative that works directly with Hill & Marks. And we can get you this presentation, and also, Brian or myself, we would also make ourselves available if you wanted to do some type of a, video call or a WebEx type setup like we just did here.
And I'd also like to mention that we do record these webinars, and we have the presentation available for you to download at hillandmarks.com, and we will follow up with all of the attendees here today with the recording and the presentation.
And one thing I will add, Ed, if you could go back one slide, I think it was, where it showed the, yes. So on this slide, whenever you get the deck, that link is an active link, and it takes you directly to a portal within the Ecolab website where you will have the opportunity to download all of this information in these the guidance. So not only will the presentation decks be available, but you'll have a readiness kit, you have some fact sheets and things like that that you'll be able to provide to your employees. Any other questions? Hey, Ed, I'll actually throw one out there. So if we're thinking in terms of a higher education, a college campus, things like that, are there areas that are of more concern to make sure that we want to have the right cleaning practices to prevent the spread of COVID-19?
Yeah, that's a great question. And what I'd say to that is, as we kind of discussed earlier in the presentation, there are multiple ways that this virus can be spread. One of them is through close personal contact, so that would be droplets in the air, that sort of thing, and then touching surfaces and probably touching your mouth or face and then contracting it that way. So the places that you really need to focus on are places that have a lot of people gathered or have high traffic. So obviously classrooms, you need to consider those as a space. Work with local public health authorities to understand social distancing requirements and that sort of thing. And then, disinfect high touch point surfaces within the classroom between classes, and then any other kind of public or common areas. And we did talk about the student congregation area, or even the faculty and staff. You're going to have people congregating together, possibly standing close to each other. Again, place proper social distancing guidelines, and then disinfecting high touch points within those areas is going to be very important. There are other areas too, like restrooms, and I'm sure lobbies and other sites as well. But again, focusing on the areas where the public is congregating is really going to be the best way to help prevent the spread of COVID-19 in your operation and facility.
I did want to make one point as well.
Excellent, thank you.
You guys hear me? I did want to make one point as well.
And it looks like
we highly recommend touchless dispensing systems in restrooms, specifically touchless paper towel dispensers. As a company, Hill & Marks believes that hand dryers and air dryers do spread more bacteria, specifically, germs and viruses. So we want to make sure that you guys understand that Hill & Marks highly believes in the science that backs that air dryers do spread more germs, and we highly recommend touchless dispensing systems in your restroom area. So that could be paper towels, touchless dispenser, soap dispenser, air freshener, etc. And I did want to make that point. We did have a couple questions. Are HEPA air filters effective?
And that is a really great question. I don't have the full guidance on air filtration. However, I do know that the CDC has recently put out guidance on it. When you say effective, that's a word that I'm not sure I have the answer to. But why don't I follow up and provide that guidance to you, Jason?
Sure.
So then we can provide this out to the rest of the team, because they, like I said, it's just within the last probably 2 to 3 weeks they put out guidance on air filtration specifically. It's a great question,
absolutely. And Katie, I think there was another question on there about disinfectant products becoming the availability.
Yep. So I believe our VP of Sales, Joe, is on the call but is having technical issues. So I will do my best to speak to this. He did say disinfectant products become available soon. I know that Helen Marks is working very hard with our manufacturer partners on procuring disinfectant products, and I would reach out to your sales rep or your sales representative, and they can speak on the availability. They would have more information on that than I would.
And I'll just speak to it real quickly from an Ecolab point. And if Helen Marks does not have the inventory yet, you will be getting it very soon from Ecolab, because we now have full availability of our pretty much our number one disinfectant quantities of that, and our forecast for even if a resurgence of COVID might happen, say towards the fall or sometime, we will have ample inventory and be able to continue providing it.
Hey, Jason, this is Brian. So yeah, I just want to just give you an update on the Helen Marks is actually in the same boat. So we have a healthy supply of disinfectants as well as hand soap. So we will be able to help our customers and get disinfection going for them if they aren't already on board.
Excellent. Thank you, Brian.
We have another question. What is the best way to clean and disinfect pillows and non-porous surfaces?
Pillows and what other surfaces?
Non-porous surfaces, I believe it says.
Oh, non-porous, yeah. Sorry, so I'll cover up the pillow piece, and then you said porous surfaces, right?
Non-porous, yeah.
Non-porous. Okay, so first of all, with pillows, it depends on the type of pillow. So we don't have a disinfectant to disinfect porous surfaces such as soft surfaces like pillows and blankets and fabrics on chairs and things like that. So we always recommend first, if you can, to launder the item. If there's a case that can be put over the pillow, and then you can launder the case, that would probably be best. Otherwise, the pillow would likely have to be laundered. Again, COVID-19, as what we're finding out, doesn't live very long on these types of surfaces. The risk of transmission from a soft surface is low. So I wouldn't, you might not necessarily have to disinfect or I should say wash a pillow every time that it's used. But, at some sort of frequency, you can, like I said, launder them, and that would be the best way to do that. And then for non-porous surfaces, like hard surfaces, that's where you'd use a standard disinfectant product like we talked about before. So again, follow with the EPA label. That'll have an indication of the types of surfaces that these disinfectants can be used on. And like I said, typically it's going to be non-porous surfaces as well. So just make sure you're considering material compatibility and reading the product label. And then if you have questions, follow up with your Ecolab or your chemical representative to help you with that.
I also have another question. Can you guys talk about dwell time with disinfectants?
Sure. Yeah, dwell time is one of the most important parts of disinfection. So there's multiple things you need to consider. First of all is how can you apply the disinfectant? That can be found on the product label. Some products you can only spray onto a surface, and other products you can apply actually by spraying the cloth and then applying it to the surface. It really depends on the type of testing that was done to verify the kill, if you will, of organisms with that type of a product. So how you can apply it, what kind of surfaces you can apply it to, like we just talked about. Product concentration, that's going to be very important as well. You need to have the appropriate concentration of product, to get the kill. And then there's dwell time. And dwell time means that when you apply the disinfectant to the surface, you allow that surface to remain wet for the amount of time listed on the EPA label. That's considered your dwell time. And that time is really needed so then the disinfectant can do the work on the surface and kill the organisms that are there. If you wipe it away too soon, you're not going to get the appropriate amount of kill. You might get some kill, but it's not going to be what's recommended by the disinfectant, and then you could have regrowth of that organism on that surface, or possibly open yourself up for contamination because you haven't properly disinfected the surface. So, like I said, dwell time is it can be anywhere from 30 seconds to 10 minutes, or maybe longer. But again, you'll find all of this on the EPA product label that's either on the actual bottle itself, or if you have further questions, you don't have the product available, contact your chemical provider or Ecolab representative. We can provide you with that information.
Awesome. We have a few more questions coming in. Any recommendations for student housing suites with restrooms that are the responsibility of the students to clean?
Yeah, no, that's a really good question. What I'd recommend there is providing for sure an EPA registered disinfectant. Make that available to the students. Put it in a spray bottle or whatever kind of method you want to do. And then I would provide some sort of direction. And the directions are all in the product label, but some sort of direction or training or something so the students understand how to use it. And then help them understand, where to use it. So, you could have signage up to say disinfect here, which would be, faucet handles, any kind of handles for showers, toilets, that sort of thing. And then I would also recommend, of course, you have hand soap available in those facilities. I'm not sure how that's restocked, if that's through the students or not, but that would obviously be very important, along with the towels to dry the hands as well. So, like I said, providing that disinfectant, I think, would be a good first step. And a good second step would be providing some sort of direction on how it's used and where it should be used, whether it's some kind of signage or through some kind of training that can be done, throughout the year.
Another question we have is when folks are using UV technology to disinfect items such as technology, should a disinfectant also be used?
So when they're using UV technology to disinfect, what was the last thing you said?
Should a disinfectant also be used?
Yeah, no, that's a really good question. We get this question quite a bit. So UV technology, it should really be used as a supplement, if you will, to a standard disinfection protocol. I don't know exactly what kind of surface you'd be using it on, but for example, if you used it to disinfect a countertop, I would disinfect that surface first using a standard disinfectant. You could use the UV light then to follow up. However, it's just supplemental and additional to that disinfection step. So the EPA registers certain devices, right? They register our disinfectants and all disinfectants, and they have very specific kill times and dwell times and everything we talked about on the product label. UV is a little bit different. The registration is not as comprehensive, and we're sure if V is the appropriate disinfection method for COVID-19 specifically. So the other thing with UV too is you need to clean a surface. You can't you can't disinfect someplace where there's a shadow with UV light, and then you need to visibly or clean any visible soil as well, because you don't want to disinfect dirt. So what I'd say to UV is follow your standard disinfection protocol. If you still want to use it, fine, but do it after you've already done a disinfection with an appropriate chemical, like we've discussed.
What products are recommended for toys and other items children mouth frequently?
Yeah, no, that's a really good question too. What I recommend there are a couple of things you could do. I would follow a standard wash, rinse, and sanitize protocol on those. So if you have access to a sink, you clean it, you rinse it, and then you use a standard food contact sanitizer on it, similar to like you would do for like a plate or a piece of flour or reusable item. So if you don't have access to a sink, I would clean it with some kind of a cleaner. I'd give them a rinse, and then I'd apply food contact sanitizer to that toy, and then I would let it air dry. Again, using a food contact sanitizer, not a disinfectant, because disinfectants aren't considered food safe when they're allowed to dry on a surface.
I do have another question for you guys. Can you talk a little bit about dilution control versus ready to use?
Sure. No, that's a really good question. So these products, they typically come like ready to use out of the bottles. So you know, if you receive a tool that's ready to use, it'll already be pre-diluted in the bottle, and then you just take that bottle and you spray it on a surface and use it as your, you know, disinfectant, if you will. A dilution control system will actually take a concentrated product in some sort of packaging, and then when you know, take your spray bottle or your bucket and you activate the dispensing equipment, it'll actually dilute that concentrated chemistry with fresh potable water to the appropriate dilution. That's typically a more sustainable method. It's typically a more sustainable method than ready to use because you know, you can refill the spray bottles through the dispenser. It's typically the more cost-effective method as well, because price per bottle would be much lower than like a standard ready-to-use product. But that's the main difference. One of them is diluted on-site to the appropriate dilution using water, and the other one is a ready-to-use, just grab the bottle and go type of product.
Will there be different dwell times between the two of them?
So, great question. There are some products that are both dilutable and ready to use that are the same product. However, always follow the EPA label. So it's possible the dwell time could be different, but if it's the exact same product with the same EPA registration number, then likely it would be the same. So really follow the product label is what we recommend. That's the best way to ensure you're getting the appropriate dwell time.
Should there be any type of concern with disinfecting products on specific surfaces and finishes? Is that something people should be taking into consideration?
Yeah, no, there definitely could be. Yep, no, there definitely could be. So, for example, you wouldn't want to use an acidic disinfectant on a marble surface. I know marble might not be the most common surface in schools and those types of facilities, but it's just an example of where there could be some kind of material incompatibility. A lot of disinfectants are quat-based. Quats are very compatible with just about every surface. So yeah, what I would say is, you know, read the product label for the surfaces that it's approved to be used on. And then if you have any questions about different surfaces, again, contact your chemical provider or your Ecolab representative, and they can help determine if there's going to be a problem. If you really want to use the product and you don't want to reach out, use the product in an inconspicuous space or a place like is typically recommended. You know, see if any damage occurs. If it doesn't, then it's likely safe to use on the surface.
Had another question. How do you address biometric surfaces such as hand scanners and copy machine screens? Yeah,
those are different. You're right. So what I'd say is, and there are definitely points that that are high touch. So one thing I'd recommend is after you use them, and while you're using them, you don't touch your face and eyes. That would be number one. And then wash your hands after use. And if you don't have soap and water, use an alcohol-based hand sanitizer. But number two, to actually clean and disinfect those surfaces, we recommend taking a disinfectant that can be wiped onto a surface, and you spray product onto a cloth, and then you wipe it onto the screen. On that surface, and products can be tricky. There are different types of screens. So again, this is kind of a hard one. I'd recommend if you have a lot of these things and you're going to be disinfecting them, reach out to your chemical provider or Ecolab representative, and we can help, consult on that depending on the type of screen. Because like I said, some manufacturers do have different types of screens and they can be impacted differently by cleaning products. But we can do testing and figure out what the best thing for those types of screens would be. But don't spray directly on them. That would be my number one recommendation.
Something I also wanted to just bring up again was the student housing question, and when the students are responsible to clean them. I do think it's important that you absolutely provide training on how to use the product, specifically any type of chemicals. I think there should be proper training for the students so that you can eliminate and reduce any potential damage. I'd also highly recommend that you provide PPE for your students. So whether that be gloves, face mask, any PPE that would be necessary for any type of cleaning, just to make sure that everyone is as safe and protected as possible. We highly recommend that. And you can find all of that product and information at Hill & Marks. So if you have any more questions regarding any type of student cleaning and training, feel free to reach out to Hill & Marks and we'll be happy to help you. But I highly recommend providing PPE as well as the instruction on how to use. So we did have another question. What is recommended for cleaning iPads and cell phones and computer touch screens?
Is that the one that's what I just talked about, right? Or is there, did I address the question before appropriately, or?
She followed up with that question after the one you just answered. So if it's applicable for both.
So, yeah, no, I mean, it's very similar. So any kind of like touchscreen, computer touchscreen, iPad, you name it. I mean, if it's something that's going to be handed off between students, you would probably want to use some sort of a disinfectant type product on it. Again, you'd apply it to the cloth and then apply it to the electronic itself. You mentioned iPads and there's other types of touch screens. It's really going to depend on the type of product itself. Between that and the chemical. Again, and your safest bet is going to be to spray a cloth and wipe the screen itself. You need to have that dwell time like we talked about. But if you have any further questions, contact your chemical provider, Ecolab representative, and that's going to be the best way to ensure, especially if you're doing this on a large scale, that you're not going to be damaging any equipment.
And Ed, if I could, one thing I would add as well is the differences in some of the different disinfectants and the active ingredients can also leave different types of results on those screens or high shine surfaces. So, with some disinfectants that are more of a quaternary base, you could notice some streaking, a haziness. It's not damaging that actual surface. It's just a residual of the product. We typically find that peroxide-based disinfectants have a much better performance on screens and high shine surfaces.
Thanks, Dave.
Yep.
A question that I have as well, and I just kind of want you guys to talk about it a little bit, is color-coded microfibers to prevent cross-contamination and how you suggest using those, and do you also suggest implementing some sort of daily task cards? What are your thoughts on that?
So color coding is a very, very good way to, determine where cloths are being used. A blue cloth for glass, yellow maybe for surfaces, red for showers or restrooms. I think it's a great idea if you can implement it, because then it prevents that restroom cloth being used on, say, a faucet or other surface that you might not want to spread those soils around. So both classroom setting, the majority of the cloth will be the same color, probably yellow. But for those other surfaces, I think it's a great idea to implement some kind of coating. And then task cards are a great idea as well. We've been talking about taking our procedure guides and forming them into more types of interactive cards, if you will, for people actually performing the tasks as well. So it's something that we're considering. I think it's a great idea. If it's something that a customer would want to implement, I think it's something we would be completely on board with supporting.
Absolutely, and Katie, I think that the task cards would also be a great supplement to the question in the comments you had about students having to clean their own restrooms and suites. Those are things that could be left behind by the college or university as, again, just that supplemental information that they can always refer back to.
Yep.
Great information. We had another question. Many employees are asking for disinfecting wipes for their workspaces. Are these products effective?
Yeah, disinfecting wipes are definitely effective if you can get them and they're available. I know that they're in a little bit of short supply right now across the nation, if you will, but they're definitely effective. And again, they need to be registered by the EPA. And if EPA has registered the product and you read the label and it says your contact time is you know, 5 minutes and you apply it to the surface and you can leave it wet for 5 minutes, absolutely, it's a great great option. The only thing I'd say about wipes is they typically are a little more expensive than you know, a typical spray disinfectant. So I'd only consider that for areas where you know, somebody who's untrained in disinfection maybe would want to use it, or in other common spaces, not for regular cleaning. But yeah, they're definitely effective when used appropriately.
One more question from me. Does Ecolab provide installation, wall charts, and in-service trainings? Am I frozen?
Jason, I can leave that one to you.
Yep, absolutely. So that's one of the components of our program. We provide all of that at no charge. We also provide the ongoing support, training, maintenance, and upkeep of all of the dispensing equipment. So whenever we go in, we are going to ensure that we've got the equipment installed correctly. It's calibrated with the concentrate, as Ed had mentioned earlier. And then our territory managers and field associates will always be on call 24 hours a day, 7 days a week for any extra service or anything else that you might need. We're also always available for ongoing training and support, whether it's in a webinar session like this. We also have online training that can be provided to any of our customers for, again, additional training in terms of day cleaning, you know, hard surface cleaning, whatever that might be. In addition to that, we also have COVID-19 training for employees and staff to make sure that they understand what they need to do. But, you know, lastly, that is 100% part of the program, coupled with the Hill & Marks support in the upstate New York market. We're able to make sure that we get every customer taken care of and trained properly every single time.
Is there any more questions from the audience? All right, last chance to ask any questions. Well, I did want to say thank you so much, Ed and Jason, for speaking to our customers and our audience today. We are very appreciative. You had a ton of information, and we are very grateful for you guys spending your morning helping us educate on how to properly and safely reopen and resume business in facilities. So we're very grateful to you, and thank you very much. And I did want to thank all of our audience here who signed up today, and you can contact the information on the screen right there. If you have any information for Hill & Marks, feel free to call, email, or visit our website at hillandmarks.com. We do have a COVID Hub Information Center at hillandmarks.com/COVID-19 where you can sign up for other webinars. We do have another webinar tomorrow at 10 a.m. in collaboration with local chambers. So feel free to join that one and sign up for that. And we will have this presentation and recording available for you to download or rewatch. So thank you again, Ed and Jason, so much for your insight. And I hope that you all have a fantastic day.
Thanks, everyone.
Yep, thank you.